Well, good morning, everyone. My name is Bill Rochelle, and I'm a sterile processing. And first off, I'd like to really thank you all for inviting me to spend some time with you today. It's truly an honor to speak with the next generation of sterile processing professionals because that is exactly what you are. You are the next gen. You are preparing to launch your career. Maybe you've even started your externship, but you are now making progress and taking steps forward to become the best sterile processing professional that you can be. Now, some of you might have already started your clinical externship. And if you have, that is so great because that is what I call the on the job interview. Whether you're doing the CBSPD certification, which typically the externship can be 6 weeks, or if you're going through HSPA, your externship should be for around 10 weeks. And it's a great opportunity for you to get some real experience, to take the didactic training and actually implement it and put it into action, which can create opportunities for you in the future to land your first sterile processing job. And so I'm so proud of you. Although you don't know me, I'm very proud of the work that it goes into. So I'm really, really excited to be able to share some empowering words to you as you take the next step in your career. So you're not only students who are, one day going to work in healthcare, but you are the next generation of a profession, right, that saves lives every day. And so I just want to give you a little bit of history about myself before I get started. My name is Bill Rochelle. I am a sterile processing extraordinaire, I like to say. Someone who's just very, very passionate about what we do. I've worked at same day ambulatory surgery centers, eye specialty centers. There's nothing in sterile processing I haven't done, and there's no instrumentation that I have not seen. And so I've trained new technicians on their very first day, and I've mentored people through their hardest weeks. I love to mentor students in externship, just really be that person that they can have that's there to support them. And so I'm just so excited for you all. And I know that some of these employees that were going through their externship, they were so nervous and they didn't know what to do, but we were able to coach them and prepare them for success. And so after 21 years, one truth has become impossible to ignore, and that is that sterile processing instruments. It's really about people. We have to know our instruments, one by one. We have to follow it every time without shortcuts. We have to protect our patients, even the ones we will never meet, right? But here's what I learned after 2 decades in this field. The thing that determines whether someone really will succeed in this profession is rarely the technical skill alone. It really is about what happens around it. It's how you communicate. It's how you handle pressure. It's how you treat the people next to you on a busy Friday afternoon, right? I have seen extraordinary things in this field. I have seen entire teams mobilize in minutes for an emergency case. I've seen technicians stay 2 hours past their shift because they knew a patient was counting on them, even though that patient would never know their name, right? I've seen people take fierce pride in their work because they understood something most of the public never thinks about. That tray you build today may be the difference between a successful surgery and a preventable tragedy. Let that sink in. I've also seen the other side. I have seen new employees quietly struggle, feeling like they don't belong, afraid to ask questions, unsure how to talk to someone with 20 years more experience, trying to read the workplace culture. Nobody explained to them, right? It's not going to be explained to you in school. It's not going to be broken down to you. These are things that the reason why I want to cover this topic today is because I wanted to make sure that you had these skills. As I was talking to Veronica Martinez and we were networking and we were getting to know each other and we were both passionate about sterile processing, this was a conversation that we had that we felt that would be so important to the next generation of sterile processing professionals. And so that is exactly what today's conversation matters. Your first sterile processing job is about more than just a paycheck. I know you think it's all about the money. I want to get paid. But it is where your reputation begins, right? It is where your confidence is built or tested. And it is where you first start becoming the professional you actually want to be. So I'm not going to stand up here and tell you everywhere a workplace is going to be perfect. It's not. There is no perfect department. Every department has its own personality, its own leadership style. It has its own quirks and challenges. Some departments run like well-oiled machines, right? We know they're out there, where every technician knows exactly where they fit. Then there's others that are still figuring themselves out, right? The tension between shifts or culture that hasn't quite, meshed together or caught up to the standards you're learning in this classroom. You may walk into the department with the manager who mentors you closely, or you may walk into one where you're handed a badge and expected to figure things out. This exists. Both of those realities exist in this field, and sometimes in departments right next door to each other. And so this is gonna definitely add value to you if you listen, if you're taking notes. You're going to get some wisdom and some understanding and knowledge from someone who's been there, done that in many facilities and many hospitals. And so what I want to give you today isn't a promise that everything will be perfect. Everything's not going to be smooth, but it's something more useful than that. These are tools, my personal perspective and confidence, so that whatever department you walk into, whether it's the well-run one or the one still finding its footing, you walk in prepared. Remember this one line, because we'll come back to it. Your certification proves you have knowledge, no doubt about it. When you test and you get that certification, it proves you have the knowledge of sterile processing. But your professionalism proves you belong. How you carry yourself in the department, in the hospital, how you support one another, how you back up your fellow technician. That is going to show, do you truly belong where you are? And so as we think about the reality of healthcare and workplace relationships, let's be honest about the profession we are stepping into. Healthcare is one of the most rewarding fields a person can choose. It is one of the most demanding physically, mentally, and emotionally. Workplace research constantly shows that healthcare ranks among the industries with the highest levels of stress and burnout. And when you dig into why people report dissatisfaction, it's so important to understand it's rarely because the work was just too hard, right? It comes back to culture, communication, and feeling unsupported. And so, as we were saying, people very rarely leave because of the work. It's always because of the environment. Think about culture as what we celebrate, what we allow, and what we do consistently, right? And so anything you see as a part of the culture is because it's consistently celebrated, it's consistently allowed, or it's something that we do on a consistent basis. And so they leave because they feel disrespected, unheard, and unappreciated. I've watched talented, technically skilled technicians walk away because of these issues. And I want to make sure that you are coming into this career prepared mentally for what you're going to face, and that you know that you made a good decision, but you're also going to have to invest and do some internal work to make sure that you keep yourself and keep that environment. You can't change the environment of the department, but you can change the environment in your mind. And those are some things that are so important. And so I just want to sit down with you for a second because it means something important for you. How you treat people, how you allow yourself to be treated is not a soft skill on the side of your career. It is your career. Treating people the right way is so important. That's why human relations and professionalism aren't just a chapter in a textbook, right? To memorize and then forget. They are survival skills. They're the difference between someone who lasts 6 months in this field and someone who builds a 30-year career. And so, as we begin to think about these things, I want you to consider how important your mindset is in what we're doing and how we're approaching it. Think about how, before we dive into dealing with other people's behaviors, we have to talk about our own, right? Because that's the only piece we can actually control. Now, here are a few things you cannot control, right? You cannot control someone else's attitude. Sue comes in upset at the world. Who knows what she's dealing with? You can't control someone else's personality, right? Sometimes you don't mesh because maybe you're one way and they're a different way. But you have to figure out a way to work together and to make sure that you're both working in harmony. You can't control someone's opinion of you, right? Whether you're that worker who works so hard all the time and never stops and people are always calling you like, the person who has to always be moving fast through the department. But you know what? These things can have a direct impact on the culture that we set in the department. And a list that we have here, that things that you can absolutely control. You can control your professionalism. How are you showing up? How are you conducting yourself? How are you responding in stressful situations, right? You can control your response, your work ethic, your integrity, and your character. Maya Angelou put it best. She said, people will forget what you said, right? People will forget what you even did. But it said, people will never forget how you made them feel. When you're showing that, going from sympathy, like feeling sorry for someone, but getting to that empathy of trying to understand what it is a person is going through. You think about, maybe you're picking a case card and say You're very good at picking cases, and someone else is trying to pick cases and they struggle and they're not the best. But when you take the time to actually teach them, because teaching someone something takes energy, it takes time, and it's a sacrifice. It's your willingness to pour out of yourself into somebody else. And when you do that, you will begin to really see how that allows you to be empathetic and you're able to relate and understand. Maybe even asking a person, what do you find difficult about picking cases? Maybe I can help you. So I hope these things will encourage you in your quest to be the best. Think about every time you walk into a department, right? Every single person you interact with, a coworker, a nurse, surgeon, is forming an impression of you in real time. That impression becomes your reputation. And in the field this small, your reputation will follow you for no doubt. So ask yourself honestly, what impression am I creating? Is this one interaction at a time? Is it built up? What impression are you leaving? And then another thing I want to talk and leave with you is the ability to communicate boundaries as a new employee. One mistake I see almost every new employee make at some point is they believe that success means yes to everything, right? Oh, yes, success is I'm going to do everything. I'm never going to say no all the time, no matter what. That thinking goes, if I never push back, everyone will like me and I will fit in faster. But you have to understand that's an instinct, right? But healthy, sustainable professionals understand something different. They understand the importance of setting boundaries. In our field, boundaries aren't about being difficult. They protect you, right? They protect your team. And this is the part people forget. They even protect our patients. Think about what actually sounds like to set a boundary as a new technician. I would really like to help you with that, but I need to finish this priority first. Setting boundaries. I'm still learning this process. Can someone verify my work before it goes through? Setting boundaries. I don't feel comfortable doing that independently yet. Can someone guide me through it? Right? Setting boundaries. None of these statements show that you're weak, right? Every single one of them is a statement of responsibility. And in sterile processing, asking a question is never a sign that you do not know. It is a sign that you care enough to get it right. And in this field, getting it right is the entire job, right? I'd rather train 10 new employees who ask questions constantly than one who is too afraid to speak up. Guessing is how mistakes are made every time. And the only person that's going to really suffer will be the patient. Here's another scenario worth thinking about. It's the middle of a busy shift. The case card schedule is backed up, and someone hands you an unfamiliar tray with a rush label, just get this done, we're behind. Now, you have two choices here, right? You can nod, feel the pressure, push through it, or you can pause and say, I want to make sure this is right. Can someone walk me through this tray before I sign off on it? That second option might feel slower in the moment, but remember, it is going to help us to do the right thing. Speed never outranks accuracy in this profession. We must make sure that we are doing things with 100% accuracy, because everything we do, from testing the scissors, making sure the laparoscopic insulation on the instruments is 100 working so that we don't burn the patient and we don't burn the physician or the scrub tech. But always remember, speed never outranks accuracy in this profession. Another thing that's vital in our success in sterile processing, as we think about the human element of the relationships that we have, is giving and earning respect. Respect is one of the foundations of this profession. So let's define it clearly, because sometimes people get it backwards. Respect is not something that only flows towards people with the most years of experience. Your respect is demonstrated through action by anyone at any level. Respect looks like showing up prepared, right? You're respecting the facility and the leadership. You're respecting your team, making sure the burden is equally distributed and that we're not putting a burden on somebody else. Respect is being dependable, right? On time, ready to work. I always say, if you're early, you're on time. And if you're on time, you are late. If you're supposed to start at 9 and you get there at 9, you are late. You want to be early. I got a job at a trauma hospital because as a student, as an extern, I was early every day. Early enough to make coffee in the break room. I was there early enough to hear I was there showing my face, giving my resume. The managers, you know what? That created an opportunity for me. And if you do the same thing, it can do the same thing for you. Respect is actually listening when someone's talking to you. Respect is keeping that cell phone out of the sight of everyone unless you are able to use it and they approve it. Respect is helping others even when it's not your job. That shows respect. Respect is taking accountability when you make a mistake. I respect this organization. I respect the leaders. I respect my preceptor by coming to them and saying, hey, I made a mistake. Please help me fix it. I won't do it again. Respect is treating everyone in the department professionally, from the newest hire even to the directors, right? And this is also something worth remembering, especially on the hard days. That person with 20 years of experience, the one who seems to know everything even without thinking about it, that person was once a brand new technician too, standing exactly where you're standing, unsure, and believe me, they were nervous. Never forget where you started, because you will not stay a beginner forever, and how you remember this stage will shape you and help you to treat the next beginner the right way. We think about this topic, handling unwelcome behaviors, right? This is something that sometimes is going to happen as you're a new employee. You think about a new employee, you will run into cold attitudes, right? Clicks, gossip, being ignored, sarcasm, that sinking feeling that you're a burden every time you ask a question. It happens in healthcare, just like it happens everywhere people work together, and especially when they're working in a place where there's pressures. These situations are very discouraging, right? Now, I will not minimize that, but I want you to hold on to this. Someone else's behavior does not determine your value. Your value is not determined by someone else's behavior. And I know you studied, you've learned instruments, you've done your externship, and I want you to know you have something to add to these departments. You really do. Do not let imposter syndrome show up in your life to tell you that you do not belong here. You do belong here. You belong with those scrubs on. You belong with that badge. You belong in sterile processing because you did the work and you are working hard. Whether you pass your test, whether you're going to pass your test, no matter where you are, you deserve here. And believe me, you have value. Do not let one difficult coworker convince you that you don't belong. You do belong here. Bill Rochelle says you belong here. You earned your place in this program, and you will earn your place in your department. One competent professional day at a time. So please keep your mindset focused. You were meant to be here, and you deserve to be here, just like anybody else. Stay professional, stay teachable, and make sure you're actively looking for the positive influences in your department, because they are there. Believe me, they are there. I always say, find someone that pours into you. Whenever you start, find someone that's going to pour into you and lean in on that person, because one day you are going to be that person that someone leans into. You want to learn as much as you can so that you can turn around and be a preceptor, a coach for the next person coming behind you. I love that pay that forward. And actively look for the positive influences, right? Because they are there. Find the mentors, the patient trainers, the people who remember what it was like to be new. Lean into those relationships. You want to make sure you do not become the person who made your beginning difficult, but be the person you needed when you were the one standing on there that nervous day. You're investing in becoming someone that someone else needs. And that's one of the greatest feelings, is knowing that you can be there for someone coming behind you. Another strong quality to be successful in sterile processing is the ability to communicate with your team. Strong sterile processing teams are built on one thing more than any other, and that is communication. If our communication is broken down, then we will lose the battle. In any war that's ever happened in history, they always say communication. Take out their communication, and the war is won. And we are here. We are fighting dirty, as Beyond Clean, Hank Balch would say, and we are here to destroy, anything that would infect our patients and harm us as well as the people that we serve. Good communication can show up asking questions instead of guessing. It can show up clarifying expectations before you start a task, giving updates so nobody is wondering. That is so important. And actually listening, not just waiting for your turn to talk. Now let's think about these phrases that get people and sometimes patients in trouble. I assumed. I thought someone else did it. No one told me. Those three phrases should make the hair on the back of your head stand up, because in our field, the assumptions are where errors live. Instead, train yourself to say, can we clarify the process? I want to make sure I understand this correctly, right? Can you help me learn the correct way to do this? Communication will prevent mistakes. And in healthcare, preventing mistakes protects our patients. This isn't just workplace etiquette. It's part of the job description, where it's written down or not. So we think about another thing that can really have a great impact on us and our surviving sterile processing as a career and growing and that is the workplace toxicity. No matter where you work, you're always going to have that person that is just angry at life and doesn't like their work environment, right? But how do we handle it from our mindset perspective? How do we think when in that situation? You think about it, I would be doing you a disservice if I didn't address this directly. Toxicity in the workplace, it exists. And they can absolutely affect your confidence and your performance if you let them. Toxic behaviors can include things like constant negativity, gossip, bullying, undermining coworkers, refusing to teach, and creating an atmosphere of fear instead of learning, right? But here's the hard truth. You may not be able to change everyone around you, but you may only be able to fix it single-handedly. You can decide every single day, what kind of professional are you going to be inside that environment? Our environments are changed, and toxicity can have a lot to do with culture, right? I also want to be clear about something. There's a difference between a hard day and a toxic pattern, right? Everyone's going to have a hard day, a short staff, a heavy caseload, someone's patience is wearing on them, or maybe someone had a death in the family and they're just really not in the mood to do SPD right now. And that's understandable. We all get the opportunity to have these days. And that's why toxicity is present at times in healthcare. And it can also become a pattern. The same person consistently undermining you, a culture where mistakes are hidden instead of celebrated, an environment where asking a question gets you mocked instead of taught. If you find yourself in one of these genuine toxic environments, reach out to your supervisor, express your concerns, and be patient as they help you to navigate how to survive and make these changes, because you can truly, truly do that. And this also ties into being professional. Ask yourself regularly, am I adding value to this team? Am I helping create a better environment, or am I contributing to a worser day? Every single person in the department shapes its culture, including you from day one. Another area that I would like to talk about in our session today is feeling taken advantage of as a new employee. This one is common, so let's name it. Many new technicians start to feel like, because I'm new, I get handed the hardest, dirtiest, and most tedious assignments every single time. Sometimes, honestly, that's just part of paying your dues and learning the trade from the ground up. And every experienced tech is going to go through this. But sometimes, truly, it is generally unfair, and this needs to be addressed. And I would highly recommend communicating this with your preceptor when this comes up. And instead of thinking, why do I always have to do this? Try saying out loud to the right person, I've noticed I've been assigned this task several times in a row. Can we talk about expectations and how tasks are being distributed? This is a good way to turn your frustration into fuel for change. That single sentence, said calmly and professionally, will do more for your career than months of silent frustration ever could. Professional conversations create real solutions, and silent resentment only creates distance. And I know sometimes you'll be having to have conversations that are difficult as it relates to approaching these long-term employees, your senior techs. I know this can feel intimidating. Someone who's worked in sterile processing for 15 years carries an in-depth of experience and really truly does deserve a genuine respect. But something to remember is experience does not mean someone is always correct. Practices change, standards update, and even the most seasoned tech can fall into an outdated habit without realizing. So approach these conversations with respect, not confrontation. Instead of saying, you're doing this wrong, say, I wanted to ask you about this process. Can you help me understand why we do it this particular way? I have a question, and I'd really appreciate your perspective. Another thing I would like to bring to your attention, and as you consider to incorporate into your makeup as you enter into this wonderful career, is how behaviors can limit your career success. Some things that can derail your career very fastly is, how we allow our behaviors to impact the work. This can show up through poor communication, being defensive when receiving correction or feedback, and just having a consistently negative attitude, being resistant to corrective or coaching, and even just gossip. One thing to really remember is employers can teach you skills. They cannot teach you professionalism. That has to come from within you. The core of you is your heart, right? The core of the watermelon is the heart. You know, my in-laws, they like to eat good watermelon in the summertime, and they say, I want the heart, I want the core. So you want to make sure that these skills are coming from your heart. And that's going to help you to protect your reputation the way you would protect a sterile field, you know? And so your name follows you throughout this entire industry, and you want to have a good reputation. And so mostly what we're saying here is we want to become a professional that others want to work with. We want to be a value added employee. And I really want you to build the simple daily habit. At the end of every shift, you should ask yourself 4 questions. Number 1, did I help someone today? Number 2, did I learn something today? Number 3, did I improve even a little today? And number 4, did I represent this profession well today? Careers aren't built in dramatic single moments, right? They're built in small, repeated choices, the ones no one applauds, that add up to reputation you can be proud of. So as we close out today, I want to say one day, sooner than you think, you will no longer be the new technician. Someone else will walk into your department nervous like you were, excited like you were, and unsure of everything like you were, and just like you are right now. They will look at you the way you're looking for guidance today. And the question to you is, what kind of professional will you be for them? Will you remember what it felt like to be new, to be brand new? Will you teach them? Will you mentor them? Will you coach them? Will you be empathetic to them? Will you encourage them? Will you make someone feel like they belong, just like someone will do for you? Dr. Martin Luther King Jr. asked, life's most persistent and urgent question is, what are you doing for others? And I want you to carry that question with you into every shift for the rest of your career. Every tray you build matters. Every instrument you inspect matters. Every decision you make in that department matters, because behind every single case is a real person, a father, a mother, a uncle, an aunt, a grandparent, a part of someone's family. You may never meet them. You may never know their name, but your specific work will absolutely reach them, because you are not just sterile processing. You are patient safety, you are quality, and you are excellence. Even before that surgeon ever picks up an instrument. Think about that. Let that sink in. Your profession needs you, not someday, but starting the moment you walk into the door, they need you. Believe in yourself. Keep learning. Stay humble and stay professional. And remember this above everything we've said today. Your career does not begin when you become experienced. Your career will truly begin when you choose to be a professional. Once again, thank you very much for letting me come. This is Bill Rochelle. I'm very glad to have been able to share some of my experiences and my wisdom with you. And I want to congratulate each and every one of you as you progress forward in your sterile processing quest to be the best. If you would like to find me or reach out to me, you can find me on LinkedIn. My name is Bill Rochelle. That's BILL. RISHELL. You can also find me on YouTube, Sterilization Station Podcast, where we inspire, motivate, and encourage all of sterile processing. I hope you have a wonderful day today, and thanks again, and best of luck to you. And I hope to see you one day in sterile processing. Take care.